Often nowadays that we hear the phrase, the doctor will see you now. Am I right? But there's a good reason why suddenly the doctor's surgeries, particularly the health centres up and down the United Kingdom, have suddenly got active, particularly on Twitter, on text, and more importantly on Zoom. So as ever, we'll explain. Hi, good morning, Neil Sean here in the very heart of London. This story really I wanted to share with you because as ever we do investigating and we like to share with you exactly how things are operating in this 21st century world. I don't know about you, but I find it fascinating really now when you want to book an appointment with a doctor because you have to tell a receptionist how you feel. So you're self-diagnosing before you've even got to see or speak to a doctor. Now these are not trained people, I might point out, these are just receptionists, but they want to decide whether they feel it's fatal enough for you to then move forward and get an appointment. You get the picture. That's after, of course, you've waited around about 40 minutes pressing redial on your phone in the vain hope to try and see someone. Don't bother turning up at the surgery because without an appointment they don't want to know. But have you also noticed the big trigger factor in their sudden caringness about reminding you of appointments like for the flu jab or a survey they're doing, etc., etc. Now there's a good reason behind that, so I'll explain. For instance, a good colleague of mine suffers from asthma, and the bottom line is that they decided that they wanted to send her to an asthma clinic, something that they ran in-house at that particular surgery. All very kind and noble, you might think. Turns out though that the nurse actually running the asthma clinic wasn't really trained in that sphere at all. In fact, the person that she was speaking to was far more knowledgeable about their asthma, having had it for 40 years and trained herself in pharmacy. So you can understand how this story is fascinating. But it turned out, you see, that the more people that they get to tick through that particular survey, that particular college, if you like, of meeting people for the asthma clinic, they can claim for, they can put it down for money. This is the bigger picture moving forward because it's not just that. You know the phone call and the text message about come and get your flu jab? Well, they want you to go to their health centre because while you can go to an independent chemist, that can't be claimed back from the government, you see. So the more that they keep in-house, as they call it, the more money that they make. Interesting to note also, isn't it? Because when you look at a regional doctor's salary, it's around about, for a head doctor, £83,000 a year. Not bad in the provinces when you look at the bigger picture. But also when you notice the bigger things, like when they're asking you, well, would you like to come for a blood test for this? And suddenly you get about 7 or 8 different options. The options are, of course, that you could have all sorts of tests because they can claim for that. But if you tell them that you particularly want to have an X-ray or something that you're concerned about, that can take infinitely longer because that comes out of their personal budgets. And then finally, of course, you'll notice that there's that fabulous gem that they tell all patients when they want them to go off the books. Simply go home and take some paracetamol and let's see if it gets any worse. Paracetamol, you see, is very cheap. Basically costs less than pennies to give you, and more importantly you can buy them for pennies yourself in a supermarket. So they don't necessarily make any money on that. What they're basically saying to you is this: if you don't feel particularly well and it gets any worse, then yes, contact them, but as ever, only if you can, and then if you're lucky getting through, you may, just may, get a Zoom phone call. The reason why they want to do Zoom is they don't want you clogging up the surgery. And more importantly, they want to get brand new customers, as they call them, not repeat offenders. People who come back because they feel maligned or indeed feel that they've got an ongoing illness. Now, I'm not knocking the NHS, and I'm certainly not knocking regional practices. Not all of them go under this particular mantra. Some actually do care. But my experiences with regional practices so far has simply been this. They obviously say to you, well, if you don't feel very good, we can look at that in 2 years' time. If you can afford to go private, then they want to organise that for you, but only through their channels. If you go independently, then they don't get the money. So you see, the doctor may see you, but only if it's good for their business. Neil Sean in the very heart of London.